Hello and good evening, everybody. Welcome to this latest Canary Live event. Tonight we are going to be delving into the coronavirus crisis and giving you an opportunity to ask your questions of our panel of experts. I'd also like to welcome audience who are coming to us via Real News, Britain is the People, Dorset Eye, Evolve, Unity News and Wear Red. Welcome to the Canary's live stream. So by way of introduction, our three panellists are Dave Carr. Dave is a trade unionist and an intensive care nurse at St Thomas's Hospital in London. So right on the front line of all of this. You may have seen him interviewed in the media recently as well. Then we have Anthony Costello, who is a paediatrician, scientist and former director of mother, child and adolescent health at the World Health Organization. He's also a professor at UCL in London, co-chair of the Lancet Climate Countdown, and a member of Independent Sage. Then we have Emily Apple. Emily is the senior editor at the Canary. She's also a founding member of the Network for Police Monitoring. She's worked on issues around policing, surveillance, and civil liberties for over 20 years. So welcome to the panel. We can see you all there. Great to see you. Thank you for being here. We know you're all extremely busy at the moment, so we appreciate you taking the time to come and be with us and our audience. So I'm going to start by asking some fairly broad questions of each of the panelists. After that, we'll open that up to questions from our audience. If you want to ask a question, please just post your question in the comments on whichever of the Canary's platforms you are watching on. If you're watching on a non-Canary platform, we may not see your question. So do head over to the Canary on Facebook or on YouTube to ask your questions. I think that's all of the housekeeping done. So I'm going to start with Dave. Dave, you're right on the front line of all of this right now. We hear lots of reports of how difficult that is. I've also heard colleagues in the medical field talking about some of the more positive things that are happening, things around their experience of teamwork, about discovering what resources we do have to deal with a crisis. But on the flip side of that, this is a crisis that has been going on for a very long time, and there is surely an enormous amount of physical and emotional fatigue going on. So a broad question to you, Dave, just to ask you to tell us about what this is looking like right now on the front line in your experience.
Okay, so I think the first thing I'd want to say is that the second wave is a lot worse in terms of the amount of patients that we're seeing in our ITUs than the first wave was. And I think during the period of the discussion, hopefully this will come out. But there's a real sense amongst us working in critical care and working in the hospitals, all across the hospitals, that this was unnecessary, that we didn't need to be in this position. And we feel, and I feel personally, that we've been put in harm's way by the way the pandemic has been managed by the politicians and particularly the Johnson government. So before I explain to you what the consequences of their shocking management of the pandemic are, I think that point has to be made absolutely clear. I mean, that's a position that I think we take inside our hospital amongst my colleagues inside my union branch, and I'm sure that's shared by hundreds and thousands of health workers up and down the country. We feel we've been really badly let down, and we've been placed in danger, and our patients have been placed in danger by the incompetence of the Johnson government. And this is the consequences of what we're dealing with now. So I work in intensive care, and most major hospitals have got intensive care units. So imagine an intensive care unit that goes from its normal capacity, maybe it's got 10 beds, maybe it's got 15 beds. Imagine that going up to 30 beds or 40 beds. In my hospital, we've gone from 50 critical care beds, and remember there are speciality beds as well, patients that have had major operations, cancer, they've been in trauma, etc., or winter pressures. We've now gone from those 50 beds with maybe some flex beds up to capacity for over 200 patients. And at one point recently, we had over 200 patients in our critical care unit. What that means, when you look at my particular section, we've gone from two or three intensive care units up to nearly 11 as we've expanded our capacity across our hospital at the cost of other services that normally would be running. It is something that I never thought I would see in the NHS in my lifetime, or in any of us' lifetime. It is almost beyond comprehension. If you imagine a long Nightingale ward, that's where I work, and it's got row after row after row after row after row after row of patients with COVID-19. One of the things that's really startling for us is that virtually every patient in our critical care, not everyone, but virtually every patient in our critical care at the moment has the same disease, and we've never seen anything like this before. So if anyone doubts, how real this pandemic is, how devastating this pandemic is, take it from myself, as someone that's working in a critical care environment, that on my unit, every single patient has got the same disease. So what we're looking at is a patient in a bed. They're around my age at the moment, into their 50s, into their 60s. They're on a breathing machine, which means there's a tube in their mouth. They're being supported by ventilators. When you put someone on a ventilator, you have to support them with a lot of additional drugs. We have to keep them really sedated. We might have to support their blood pressure. Some of these patients' kidneys might not be working properly. Other organs might fail. And just imagine 1, 2, 3, up to 200 patients in various states of being critically ill. Whereas we would maybe have had wards with 15 beds on, now those wards have got 30 beds on. My unit normally has around 11 beds, but we've expanded to 22 beds now because of the massive impacts. And what I do is, and what our nurses do, and I have to point out that, as we've expanded critical care capacity across London and across the country to deal with this devastating pandemic, we haven't expanded our critical care nurse workforce because we just can't expand them. It takes years to train an ITU nurse, and actually, ITU medics as well, and all of the other support staff that you need to run an ITU are thin on the ground like you wouldn't believe, which means that as we expand our patients, as we move from unit to unit to unit, that means that we have one nurse looking after 2 patients, 3 patients, 4 patients. Sometimes if there's ad hoc sickness or there's additional pressures from elsewhere, it could be up to 5 patients. So that means that one individual has responsibility for looking after people that are entirely dependent on the nursing staff to survive, to be alive. And the responsibility of that is absolutely enormous. We have got additional people coming in to help us, but the reason intensive care works is because you have one nurse and one patient. And what we're now doing is diluting that skill mix out so that we can look after the most amount of patients possible in this acute period that we're facing. And that puts massive strain on the nursing workforce. It puts massive strain on the medics. And my job is to keep people safe. So, when I'm used to looking after one patient, that's a lot of responsibility. But if you take that up to 2 or to 3 patients and they're all very sick, it means that, the pressure on the NHS is absolutely enormous. And the impact of that on our staff is quite startling. We came out of the first wave exhausted, and we've come into the second wave with some of our staff unable to work in COVID areas, some of our staff shielding, a lot of our staff caught COVID because it ripped through the community. We came in with the same concerns about PPE as before. we saw from afar the rise in figures, the rise in hospital admissions, and we watched with abject horror the politicians' response to this. And now we are left, if you like, dealing with that that mess. But the mess for us are human beings that are really sick and are dying, and a workforce in the NHS that has been under so much pressure that I think one of the questions that we should be talking about is, how do we plan for the NHS in the future? How do we actually get back to normal working, and what kind of a health service do we want in the future? So it's been, to summarize, it's extremely hard work. It's extremely noisy. There are alarms everywhere on the units. You're wearing full PPE, so there's a heat. Imagine 20 to 30 bodies in some of our critical care units. Then you've got 30 nurses in, not all of them ITU nurses. Then you've got the medics in, then you've got the physios, then you've got the turning teams, the comms teams, the tech staff. The physical heat in a lot of our intensive care units means our air conditioning can't deal with it. And there's the dealing with our patients' relatives as well. They can't visit unless it's in a really sad situation where patients are dying. So we're having to communicate with patients by phone. It is a really, really, really tough time for health workers. And it also means that, my job normally is to look after patients that have had cardiothoracic surgery. They've had valves replaced. They've had grafts done on their hearts. This is life-saving surgery in a lot of cases. And apart from extreme emergencies, it's not being done. People are on waiting lists, and this goes for a lot of other operations. Some emergencies are being done, but the impact on the NHS of this pandemic isn't just us frontline workers dealing with people that are sick with COVID-19. It is all of the other patients that can't get their treatments. And remember as well, the NHS has been under huge pressure. I mean, I think people viewing this would have seen the queues outside hospitals of ambulances in 2019. The pressure on our beds. I mean, the NHS has been underfunded for at least the last 10 years. Nursing, we've got 40,000 vacancies in nursing in the UK alone. Our turnover rate, our attrition is absolutely shocking. Our pay is really poor. I've lost a fifth of my salary in the last 10 years due to cuts by the Tories. To retain those nurses in the NHS is really difficult. I mean, I think we're reaching that existential point now, not just in the NHS, but in society. What do we want? What kind of a society do we want? What kind of planning do we want for health in the future? I mean, clearly the planning that's been done to handle this pandemic has shattered the NHS, shattered the staff in it. And I'll finish on this. 100,000 people have died of COVID-19. That's the official figures, and I'm sure they're higher now. 100,000 souls, 100,000 families have been devastated by this illness. What I see is the battle inside the hospitals to save as many people as we possibly can. But what I watch on the TV with growing concern is the shocking way in which this pandemic has been handled by the politicians, and the fact that it has put not just patients' lives at risk, but it's put the whole fabric of the NHS at risk. And it's certainly put in so much pressure on NHS staff that I fear how we're going to actually recover from this second wave. So thank you for giving me some time to get that off my chest. If you get any health worker speaking at the moment, it's you might have to put a sock in their mouth to shut them up at the end of their rant, because we're really, we are doing our best to keep everyone's loved ones safe and well, and we are doing our best, and we're doing a fantastic job. But it needn't have been like this, and I think that's what's making us really angry.
The mind boggles, Dave. I don't know how you're all still upright at this point. You paint a picture that is very, very sad. That's how I feel when I hear you talk about that, and I can see the scenarios that you're describing. It breaks my heart, really, that we've had a pandemic arrive after what are we now, 10 plus years of austerity. We've had privatisation of hospitals and medical facilities by the back door through PPI. And it didn't have to be this way. That's what I'm left with, is it didn't have to be this way. We have amazing skilled people. We have amazing, compassionate people who are willing to work incredibly hard. And this is a situation where, you know, you are all beyond spread thin. And I'm just sorry that that's how it is. I'm sure that many of the people watching share the same kind of emotion as me, and also, like me, would like to thank everybody who is spread that thin and having to deal with unprecedented conditions to work in, and not to mention, you know, the challenge that you face when you're someone who is driven to help people to improve their health, to save lives. And there are many, many factors right now getting in the way of that, which, you know, mostly derive from decisions that have been made at a policy level. Now, I'm waffling on slightly because I can see that our next speaker has had to pop out briefly. So I'm hoping that Emily Apple won't mind me coming to her next. Brilliant. Hi, Emily. Thank you.
Great.
So, we'll go in a slightly different order. I don't think it matters, but Emily, we as citizens are being asked to do a lot of things differently right now, and in some cases we're being told to do things differently, and there are laws being made that make it illegal for us to not do things differently. Obviously, you know, we accept that there are behavioural aspects of controlling a pandemic that we all have to sign up to, but I also understand the kind of fear that a lot of people have about the erosion of civil liberties, about, you know, is this a slippery slope to an even greater kind of big brother state, to an even greater kind of, you know, almost kind of militaristic style rule. Could you just outline for us a little bit about kind of how you see the current situation and how we can, you know, as individuals and also kind of strike a balance, and how we can, what we can demand of our representatives, our policymakers, to ensure that we protect health and civil liberties as two very important aspects of life.
Yeah, absolutely. And I think any critique of the policing has to start with the acknowledgement that everyone should be following the lockdown laws. This isn't about saying that people shouldn't be staying at home. I mean, anyone who just listened to Dave knows that. And this is a public health emergency, and we all need to be doing what we can to support that. But what's happened is the police have been unleashed and are reacting in terms of public order and public order policing to a public health emergency. And there's questions over whether that's even needed. The actual compliance rates with lockdown have been high. People want to do the right thing. The country isn't full of people wanting to break the laws. It isn't full of people wanting to put lives in danger. It's full of people wanting to do the right thing. And figures at the end of weekend in the 10th of January showed we had the highest compliance with lockdown we had since the first lockdown, with 96% following all or most of the rules. Now, this stands in stark contrast with the messaging that we're getting from the government. And we've got a government that is seeking to put the blame onto individuals. We've had people like Boris Johnson, Priti Patel come out day after day after day telling us that it's our responsibility, it's our fault if we don't follow the rules. But we are following the rules. The reason we're in this mess, the reason we're facing this tragedy, the reason why our wards are looking, like they've just been described, is because of the government's handling of this crisis. So in a sense, we've got a government unleashing the police on us and gaslighting us. They're telling us that it's our fault, but it's their fault. And I think that is fundamentally important in looking at the policing response and that balance of civil liberties, because it's about where the problem is, and the problem isn't with people not following the rules. And then we have to look at how those rules are being applied. And in terms of sort of civil liberties, we're back to the point where racist policing is once again on display. We've got a situation where during the first lockdown, the Metropolitan Police stopped and searched 21,950 young black men. That equates to 30% of all young black men living in London. So these figures are massive. People from BME communities are 54% more likely to be issued with COVID fines than people from white communities. So even in looking at the way this is being enforced, there's a civil liberties problem, there's a racism problem. It's all the endemic problems with policing that we see all the time are just being magnified by COVID. And then on the flip side of this, while we've got an assault on our civil liberties and we've got an assault on us being blamed, we've got corporations, companies that aren't COVID secure, that are forcing people to work. I mean, even at government agencies, we've had the outbreak at the DVLA recently that had over 500 cases with allegations that absences were counted against workers' sickness, and over 10 days sickness triggered a warning, that employees claimed that they had symptoms and were encouraged to work, that there's allegations that workers were told to turn off test and trace apps. So we've got this going on and no legal actions taken. But legal action that we're seeing all the time is in police enforcement. There's been, as of the 28th of January, 42,675 fixed penalty notices issued. And all the time, we've got the government insisting on keeping the economy open and bits of the economy open. Even with this lockdown, we've got more open than we had last time. And so you have to question whether this assault on civil liberties and the way the police have responded is proportionate, it is necessary, and whether it is acceptable. And I think some of that comes back to that question of, well, what world do we want to live in? And actually, I want to live in a world where people are cooperating, where they're doing the right thing because it's the right thing to do, when we don't have double standards, where there's one rule for the elite and Dominic Cummings can go off on his trip to buy a parcel, but a person out walking gets stopped by the police. We saw the case the other week last week of the man who was arrested on his way to work for not giving his details to the police when he didn't have to, when he said he was on his way to work. So I think there's really sort of fundamental questions about the way this legislation is being applied and whether it's needed and how we tackle that, because what it's done is it's actually emphasized all the problems that existed within policing to start with, and it's magnified them on a huge level, whether that be racist policing or just that infraction of police officers going, oh, we have to do this because I'm telling you to. Now, police officers always have done that, but they feel like they've got even more power to do that, and they're being encouraged to do so by the government. So it's time for us to sort of take a step back and realise that the majority of people are supporting what's going on, that they are supporting following the rules, that we do need to question the policing, that we don't want to slip any more into a situation where civil liberties are being curtailed, and being curtailed in a way that is quite scary. And we need to make sure that the blame for the crisis is put firmly back on the government, because time and time again, it's about distraction. It's about telling us that, oh, it's these people having a party that's to blame. Those people having a party should have been having a party. That was wrong. But it's nothing compared to the way the government has handled this crisis continually. And it is not the fault of individuals that we're in the state that we are. It's Boris Johnson and the Conservative government. And I think that always needs to be the perspective that we need to look at when we're looking at civil liberties and policing, and whether the measures that we've got are proportionate and necessary.
Thank you, Emily. I think in a similar way, this crisis is serving to shine a light on what were already systemic issues. I'm quite shocked by some of the figures that you've given for stop and search, particularly, and the impact on Black and minority ethnic communities. So yes, bottom line, it's not our fault, and we need to do what we can do to protect ourselves and each other. And we will be keeping a very close eye on what is happening in terms of civil liberties and policing as this goes on. Okay, thank you, Emily, much appreciated. I'm going to go to Professor Anthony Costello now. I think in both of the speakers that we've heard so far have talked about the impact of how the government has handled this pandemic on both the situation on the ground in our hospitals, where you've got this incredible picture that Dave paints of rows and rows and rows of people all with the same disease, nurses stretched to 4, 5, 6 times their limits, and the potential impact on civil liberties for all, and the actual impact on civil liberties for some. We blame the government for that. We consider that the way that policy has been made around this, the way the whole thing has been handled, has been severely lacking. It's very easy to then look to other countries around the world that are having a better time. Certainly, I look at New Zealand, which has, it has a socialist government. Is the biggest difference, perhaps, between here and there. But it's also a small island nation, and I think, perhaps somewhat naively, I thought at the start of this, well, we're an island. There's an easy way to protect our health when there's a global pandemic going on. We just shut our borders and do what islanders do in these situations. And often that comes back to me with, well, the UK is very different from New Zealand. It's very different. It's not the same. We're a much more important nation. We're a bigger economy. We're a transport hub. We're a centre of global trade and all of these things. And just to start with, is that right? Could we be looking at New Zealand or other places around the world and seeing, an alternative way that this could have gone for us?
Well, thanks, Nancy, and thanks to the Canary for having me on. It's been fascinating to hear Dave and the discussions about the legitimacy in policing. But in answer to your question, it's kind of a very stark division. New Zealand is one small nation, but I could give you China, the largest nation in the world, Taiwan, South Korea, Vietnam, 100 million people, Thailand, I can't remember, I think it's about 70 million, Finland, Germany, Norway, and all of them, if you look at some of the Asian states like Vietnam, Thailand, Taiwan, they've got less than 1 death per million population. The UK is at 1,600. That's not explained by cultural differences or political differences. To me, they followed the advice of WHO and had a public health plan to prevent this infection from spreading. And they implemented it with slight differences in each country, but broadly following the principles that you've got to find test, tracelate, and isolate this, and you've got to act fast to suppress it and then keep it suppressed. And I think before I get on to just a few words about politicians, the initial thing is that by the end of January last year, when the WHO declared a public health emergency of international concern, we knew that this was a really serious infection. We knew this was not flu. That, you know, you could see it on your TV screens. There were people collapsing in the street, people going into hospital by the hundreds. 20% of those were ending up, or more actually, 20 to 30% ending up in an ITU. And at that time, about 4 or 5% people were dying. So we knew this was serious. It was a pandemic. It had already spread from at the end of January to 17 different countries from China. So we had to assume it was going to reach us. Now, throughout February, we didn't really know what was happening here because everything was kept secret in good British style. But we've discovered since that the advisors made some well-intentioned but serious mistakes. First of all, for some reason, they assumed that coronavirus is just like flu and that it would inevitably spread and you couldn't stop it. And that went against the evidence that was emerging from China throughout February and Taiwan and Hong Kong and South Korea, that they could actually start to suppress this. And by March the 9th, when it was very clear that this had been suppressed, they changed their tune. And actually, the scientific advisory group put out in their minutes unanimous agreement that even if you could suppress the first bit, there would inevitably be a large second surge in China and everywhere else. Now, that wasn't true. It hasn't been true, if we can see by the death rates, hasn't been true in New Zealand or any of the other bigger countries. But it led on that belief, and we all heard it, didn't we, at the first March the 12th conference when Sir Patrick Vallance said, you know, we want you to get this virus. We're going to let it spread. We're just going to try and protect the NHS. And so they didn't go for a kind of elimination strategy. You can't eradicate this virus. That's absolutely true. But you can eliminate it from your territory in the same way that you can't eradicate measles, but you can eliminate it from your shores. But it led on to this view, which was then taken up by the politicians. You didn't really need to test and trace so badly, as long as you could keep it under control. They didn't.
Okay, we appear to have lost Anthony very suddenly from the online realm. Hopefully he will be back shortly. Let's, while we wait to see whether Anthony's able to get back online, let's go to a couple of questions. Now, let us get everybody back on screen. Who is here? Sorry, Andrew. I just popped our tech support in there by accident. I'm sure he wasn't expecting that. Okay, so we have a couple of questions. We got Anthony back.
Sorry, I'm up in Yorkshire and I have I'm on Wi-Fi. I'm not on Wi-Fi, I'm on a 4G phone. And it usually works, but when it goes a bit wobbly, clearly it shuts down. Sorry.
Troubles of rural internet.
Yeah, exactly.
Anthony, we'll come back to you. Do you want to just round off what you were saying? And
well, very quickly, you know, the politicians then took up the story. I think the fact that our Prime Minister did not attend not just the first meeting of COBRA at the beginning of March, at the beginning of February, when, you know, we know that the biggest risk to our nation is a pandemic more than a war. And our Prime Minister didn't attend the first 5 meetings. The first 5 meetings. I mean, it's unforgivable and it's a dereliction of duty in my view. But then, of course, the mistakes delaying the lockdown by 2 weeks that probably cost half of the lives of the first wave, according to modelers. We've heard about running down public health, setting up a test and trace system that was laughable in comparison with the successful countries, we still haven't focused on paying people properly to isolate, which is fundamental. I mean, we're one of the worst countries in the developed world at doing that. In fact, many countries in the emerging have done much better. We then
oh, what a shame. The rural internet gremlins are definitely not playing nicely tonight. This I understand, living quite rurally myself. Okay, so we've had a few questions come in. I think, Dave, let's go to you for this first one. We've got a question about what treatments are actually available to people with COVID in the UK. Is it possible to receive treatment in the early stages that will improve your symptoms and outcome without having to go into the emergency department or otherwise be admitted to hospital? Is that something to deal with, Dave?
Yeah, I mean, it's. I think it's very difficult for me to talk specifically about individuals that are becoming unwell with COVID. My advice would be, if you feel unwell, 111 or 999 if you're getting short of breath. There are treatments that we can use and are being used, and I think dexamethasone is one that people have heard about. So steroid use, and obviously we're using antibiotics for the bacterial infections that also accompany a lot of the viral infection. What there isn't a cure, and at my hospital, everything that can be that has been shown to work is being used. So, but a lot of the treatments that we are using that have been touted by the press, like the dexamethasone treatments, are being used before patients actually get to intensive care. So there's no guarantee that if you have these treatments that were spoken about during the period after the first wave, that you are going to avoid coming into the emergency rooms. It's a predictable disease in that we see its monotonous way that it drives people into hospital with shortness of breath. But how it actually represents itself when people become sick obviously depends on what some of their underlying conditions are and what other comorbidities they might have, what their age is, and their ability to fight this infection themselves. But what I can say is there is no cure for this disease at the moment. What there's excellent support for patients that become unwell, but unfortunately with this virus, some patients and a lot of people have declared themselves. In my environment, in the intensive care unit, they die. In intensive care units, mortality in the second wave is less than it was in the first wave because of the new treatments that we've been using. But we've seen the amount of people have died from COVID generally, and actually the second wave has been devastating in the amount of deaths there have been since November. So there are treatments, and these are often peer reviewed. Not a lot of these treatments will be will come online as soon as there is the evidence to show that they work, but there isn't a cure.
Okay, thank you, Dave. So bottom line is, if you're unwell and you think you have COVID, 111. If you're short of breath, 999, and the medics will take it from there. It's good to hear that the frontline treatments are potentially improving things a bit for people. I'm going to ask a question to all of you now. We've all been critical of the government in this first half of tonight's event. The Canary is infamously critical of the Conservative government, but the mainstream media perhaps less so. So a slightly loaded question: do you think that UK mainstream media has provided sufficient scrutiny of the way the government has responded to this pandemic? Should we start with Anthony and go from there?
Well, we have a a mainstream media, which is veers towards the, if you like, the centre right wing funders. I mean, we know that most of the main publications, apart from perhaps the Mirror and the Guardian, possibly the Independent, tend to be on that side of the political spectrum. The BBC has to be quite cautious because whatever they say, they upset people, and they're aware that their funding depends. So they have disappointed me somewhat during this pandemic, but there have been things that they've, on the science, they've been pretty good. Their website is quite good. I think Channel 4 has been the standout channel for addressing this. I think they've been generally excellent. Actually, I've done quite a few appearances on Sky, and Sky News do give you time to give your case. They do ask questions and the like. So generally speaking, I mean, we've been bombarded with all of this. Everyone's become an epidemiologist and a virologist without doing a course, But I think my one criticism would be that none of them, I think, have sufficiently focused on the public health issues. People like to think that, there's technical gadgets, that it's all about variants and vaccines. And of course, the vaccine is fantastic. I mean, that is one area where we can claim, we have got a vaccine. It has been developed quickly through a public-private partnership. It's been procured cleverly, and it's being rolled out largely through the NHS. My question would be, why didn't we prevent this through the NHS? Why didn't we set up these crazy schemes with Serco, Citol, Deloitte, when we could have invested in local public health, recruited local contact tracers, not call center people, linked them in with primary care and GPs, and then we would have had a system that I think would have prevented over half the deaths we've seen. And I think the current, if you look at Chris Giles in the Financial Times, he's saying today that there are probably 116,000 deaths in terms of excess deaths that have occurred rather than the stricter government definition.
No, I agree with an awful lot of what you said there, Anthony. Some of you may already know my background is in science communication, and I've always worked at that interface between the scientific community and the media. And there have been times during this last year that I've felt pretty grim, actually, about how this stuff has been handled, and even by outlets and journalists who I know better from those years of experience. So it's great that there are some better examples like Channel 4, but I think on the whole, compared with my experience of working between science and media 15 years ago as compared to now is very, very different, and not in a good way. I feel like we've in a lot of ways slipped backwards, actually, in terms of the relationship that media has to evidence base and to
Not just that, Piers Morgan. Yeah. We shouldn't forget Piers Morgan.
I know, right? I never thought in a million years that Piers Morgan would be the shining light of good journalism that he's been.
I mean, I have to say, I was on the Good Morning Britain show, and it was live, and it was just before I started work, and I was given the opportunity to ask or say what I thought of Matt Hancock. And I think, I know I spoke for virtually any frontline health worker when I said, if I carried out my duties like Matt Hancock had carried out his duties, then I'd be out of a job, I'd be sacked. And the response from that around my hospital, and then the amount of support I got, like messages that were sent to me, was just absolutely overwhelming. And that speaks to what you were saying about the media, because there is a real sense in the NHS that we what the true tragedy of what's going on in the NHS is not being reported. You get the winter crisis and the queues of ambulances, and the BBC roll down there and they, take pictures, and you get Matt Hancock or Jeremy. I mean, I can't believe that Jeremy Hunt is being now lauded as a sensible person, that has got a real handle on what's going on with it. Why he presided over an absolute disaster in the health service. And if anyone can remember the Andrew Lansley bill, the health and social care bill, which has devastated our public health. I mean, Anthony's absolutely right. My partner works in public health, and it has been utterly eviscerated. And that's what gets us really angry in life. I mean, during the first wave, everyone wanted, pictures of health workers wrapped up in PPE. And you know what? My colleagues everywhere in the health service have worked flat out. But it was almost as if, well, this is great. These are health workers. They're working really hard and they're crying and they're telling us how tough it is. Then after the first wave, and our first wave was so tough to deal with because we started off with, there's 10,000 nurse vacancies in London alone. There's 40,000 vacancies across the country for nursing staff. Critical care is short of staff all the time. And one of the things that made our job so hard was the lack of critical care beds and the lack of nurses. Why isn't the Nightingale Hospital open now? There's one reason the Nightingale isn't open now. Who would staff it? There isn't anyone to staff it. It's an absolute joke. And that, I think, is what really upsets us, is that my understanding of the press is it should hold it should hold power to accounts. So what about the mess of the Nightingale hospitals that haven't been able to be used because there aren't the nurses in them? What about the scandal of pay in the NHS? I've had my pay cut by a fifth in the last 10 years. If you saw what our junior nurses start on, it's, you can't believe that they'd even want to come into the job anyway. The bursaries for student nurses were cut. So our student nurses end up with £21,000 in debt. And after the first wave, we had a load of pay protests. Remember, the announcement was made by the government, 900,000 public sector workers will get a reward for what they did in COVID, but the health workers, they got a little deal, so we'll leave them out of it. And it just enraged us because we've been taking pay cut after pay cut after pay cut. And you could not get anyone from the mainstream media to what we were doing. Honestly, what did we have to do to get on the TV? We even went to the BBC, thousands of us, nurses, and protested outside the BBC, but they weren't interested in covering us. What's their narrative? And, I think the head of the BBC is Rishi Sunak's ex-boss. So, we have such a cynical attitude towards the mainstream media now because they've treated us with utter disrespect. And now the pandemic's back, the second wave's back. We see the BBC knocking on the doors of all of the intensive care units, asking permission to come in. And I've watched the films that they done at my old hospital, UCH, and the London hospital are harrowing. And I know the nurses involved, and I know the impact that this is having on them. But all the BBC seem to want to take like pictures of nurses crying or doctors crying, and isn't this terrible? Actually, the reality is that the health service has taken a hell of a kick in over the last 10 years. Public services have been, public health has been destroyed. This pandemic is out of the playbook of Boris Johnson's and his neoliberal cronies. The PPE scandals, the Dido hiding stuff. God, the press should be absolutely doing these people over. They really should be doing these people over. I'll shut up. Someone's talking to me.
No, I think what you're referring to about pay in the NHS extends out into the population and is one of the major reasons, in my view, that public health has failed. So if you look, for example, at unemployment support, we've got one of the lowest support systems of any country in the developed world. So of your average income, if you're in Europe, you'll get between 68, 75% of pay. In Britain, you get 34%. And if you look at sick pay in the UK, sick pay, you get just under £96 a week. The same person in Canada or New Zealand, I've got the figures, at £287 or £308 a week. And we've got the lowest mandatory COVID sick pay in the OECD countries. And even the US, which is kind of famous for a terrible welfare system, they pay you your full salary when you're having to isolate with COVID. So anyone on low income, oh, by the way, if you earn less than £120, you get nothing. And we didn't, if you've got 5 million people in the gig economy and they're being asked to self-isolate, which is a nonsense in public health terms, and they've got to feed their family, they're not going to bother getting a test. And that's exactly what happened in Liverpool, where they had the rollout of rapid testing. I think less than 5% of the poorest families would go for a test because they didn't want to isolate. And worse, they were by then being offered £500 for 2 weeks, which is tiny. And 70 to 80% when they filled in the forms were being turned down. So, I mean, the whole thing is a total disincentive to stop the disease spreading. And that's exactly what we've got. And that's why you're being overwhelmed. That's why so many health workers are at the end of their tether and facing such a distressing situation. And we all know about people that we've lost.
And yet, as we say, the mainstream media are not getting real about these very real issues. I think it's an important point to make. There are some sort of beacons of hope in the media. I agree, Dave. Some of the BBC's coverage has been very good. I thought the report Fergus Walsh did at UCLH was excellent. Fergus usually is. Let's move on for now to another question. Let's see what we've got. Okay, so we've got a few questions. I think there's a real theme kind of emerging, I think, from this conversation of this. I just have this feeling of like there are a lot of people falling through a lot of gaps. And they're gaps that needn't have been. So gaps in income. So, Anthony's just given us the figures on that. Gaps in our media coverage of this issue, which, leaves us with a population that, cannot possibly have the kind of level of, what's the word I want? The level of understanding of the reality of the situation to be able to judge the information that they're getting. And meanwhile all of this is happening, there are still people who are dealing with other health issues, chronic health issues, disability, who are all in their own ways falling through the gaps. So one question is about, is there any sense of when we might get back to some kind of normality in the health service? So one of our audience members is asking because she was due for an elective surgery in November, which has been postponed several times. I mean, I'm sure there are many people. I'm waiting to have a large ganglion cyst removed from my wrist. It doesn't cause me an awful lot of problem. It hurts a bit when I play my double bass. I'd like to get rid of it, but compared to COVID, it's not a huge problem. That said, I'm used to an NHS where I can go to my GP and say, look, I've got a ganglion cyst on my wrist. Can I have a referral to a hand surgeon, please? And it happens, and then it goes. So I don't know what normal is. I mean, I think another theme that's coming out today is that we have some questions to answer for ourselves about what kind of world do we want to live in after this. And that includes what kind of health service do we want. But, very quickly, any indication of when normal service may be resumed?
Well, if you look at the progress with vaccine, that is one, where we've done a good job. We're going to cover probably 15 million of the most vulnerable people, and they will then continue. So that should be completed in the next couple of weeks. You then have to allow 3 weeks before the final group are protected, because it takes about 3 weeks to get properly protected from that, and then they have to continue. So I think hopefully, I mean, they're saying March the 8th would be schools opening. We could talk about that, but that's a separate issue. I think there's going to be a much longer period for the NHS to recover, because a lot of the people that are sick in ITU are going to be sick for a long time. I think Dave's going to be overworking for a long time. The other thing, of course, is that even if we get 20 million people vaccinated, that leaves 47 million people who will be having the disease circulating. You've got all the problems of long COVID. And if it continues to circulate, the other figure is that I think it's 75% of people under the age of 70 are in ICUs. I mean, Dave will probably attest to this, but so it's not all the old people that are being protected. And so if it continues to circulate on a high level, particularly as we start to open up again, then it's quite conceivable, particularly if you have a lot of vaccine hesitancy, that the sick people are still going to be coming into hospital, still be coming into the ICUs, probably at a slightly lower rate than now, but we're already got a hugely overwhelmed NHS. So, the vaccine isn't the sole solution. It's a very important part of it, but we need to suppress virus transmission. We've also got the worries about variants which could escape the protection of the vaccine. There's no hard evidence of that so far. There is some reduction in the response, but we still think all the vaccines are protective. We definitely need to have a campaign to reach out to vulnerable Black and minority ethnic groups to ensure that, they feel okay about taking the vaccine, because it's from a system that has routinely discriminated and abused them in the past. And that's a large part of the reason why they're very skeptical. There may be some new treatments coming online. One of your questions says about ivermectin. There's a trial going on right now. There was an early small trial, but there are other bigger trials. Hydroxychloroquine, I think, has been demonstrated not to be useful. We do have dexamethasone, which Dave probably uses every day. And there are one or two others being looked at, like interferon and colchicine. So they're working on that, but we've got to stop the infection at source. And I fear that the knock-on effects on the NHS could take 18 months to clear the backlog. And it could be even longer than that. I mean, depending upon funding, staffing, how many people are going to leave the service. I mean, Dave's touched on this. I'll be quiet.
Yeah, so it's going to be a while, but we are heading in the right direction. And we can celebrate to a degree the fact that we have got the vaccine. It is being rolled out. Large numbers of people have now had it. But there's not going to be a swift return to normal. Andrew's just reminded me, I skipped off of the question about media before I gave a chance to Emily to come back on that, with, of course, the very important aspect of this being the role of independent media in filling some of those gaps that are left behind. So, Emily, give you a chance to talk about that.
No, of course, no worries. Yeah, no, absolutely. I mean, and actually, when I was thinking about that question, you actually have to go back a few months, or just a couple of months before we had the pandemic, to the general election, to what the media did to Jeremy Corbyn, and to those very basic ideas of universal basic income, free broadband for people, nationalising our services, all these things that the media rubbished, and the media didn't want anything to do with, and dismissed anyone who advocated those things. And they're all the things that if we had in place, and if we had a government that would put some of those things in place, could alleviate some of the things that we've talked about. And the media has a huge role in that, and in what they did. And as part of that, we need to recognise that the media is controlled by a handful of billionaires. Even the BBC, as we've said, has links to the centre-right and to the actual Conservatives. And so even what the BBC can say, it's neutral, it can say it's unbiased, but story selection is key. It's what they choose to present. They can show both sides, but they're still making a decision on what they're selecting. And like Dave was saying, about not covering thousands of healthcare workers out on the streets because they're being screwed over. That is an editorial decision because they're looking after vested interests. And that's why they're not promoting things like universal basic incomes and solutions that would help, because it goes against those vested interests. So we do have to completely support the independent media. We've been able to shine a light on a lot of the things that have been going on. We've been able to put that other perspective, and we're constantly having to fight to say we are here and we are telling you something different. And we've slipped into quite a dangerous narrative at times where people providing an alternative point of view are being labelled as fake, even by the government now. And I think this is where it slipped into being dangerous, because it's gone from, it's very different people who don't like you saying, oh, it's not true, to actually having the people in control who have that power saying this isn't true, when actually what you're doing is sort of fact-checked and rigorous. And so I think it's down to everyone to support independent media and to make sure those voices get out, so that we can cover things like healthcare workers, we can cover things like universal basic income, we can cover the fact that there are so many gaps that this government is missing, and that it doesn't need to be like that. And if we take the control away from the rich and the billionaires and we redistribute that, then we can have a different system. We just have to want to do it, and we have to be able to have the voice to be able to do it.
I think that, thank you, Emily. I think there's certainly a sense that we had when we were first even thinking about starting up the Canary, right back 5 or 6 years ago, of there being this conversation that's going on in Westminster, but it's very one-sided. And what we wanted to do was to kind of be part of bringing the other side of that conversation to the fore. And I think, Anthony, with Independent Sage, you're doing something very similar, but from the perspective of introducing people to science, to the evidence, to the ideas around policy making. And Dave, you're giving us this very different view of what this actually looks like to you working in the NHS versus what we're being presented in mainstream media. You described all they wanted was pictures of unhappy medics crying in their PPE, and there's very much more to it. There's this image of these great empty Nightingale hospitals because we don't have enough staff for them. There's images of these overcrowded intensive care units that are hot and noisy and difficult. So I'm really, really glad that we were able to come together, the four of us, and have this conversation this evening. There are many, many threads that we could now go down and carry on talking for hours and hours and hours. Certainly on the issue of the role of independent media and of this kind of rather scary, slippery slope that we're seeing towards anything outside of the mainstream being branded as fake news or extremist or or whatever. I think we'll have a separate event on that soon. I think there's much more that we'll need to say about the coronavirus crisis. I'm sure, Dave and Anthony, we will be coming to you in future to ask questions and to learn more as we go along. And just thank you, all three of you, so much for your time and for being here with us. And thank you to our wonderful audience, many of you watching on the various different platforms. And we know that you could have chosen to do all kinds of things with your evening, and you chose to come and spend an hour with us at the Canary for this live event. So thank you very much for that. This video obviously will go up online afterwards. If you want to share it with anyone who wasn't able to make it to the live broadcast, it will be available. We're already over time. I feel like we've only touched the surface, but let's let people get on with their evenings. And
thank you.
Thank you all very much. And I hope everybody has a good rest of the evening and stays as safe and well as possible.